Sir, can you hear me?
Ma'am, audible, ma'am?
Yes, sir. கேக்குது sir.
Yeah, audible. Ma'am, a few seconds, ma'am.
Hello. Sir, can you hear me, Saravanan sir?
Ma'am, audible, ma'am? Hemant, ma'am?
Yes, sir. Yes, sir.
Yeah, a few seconds, ma'am.
Okay, sir.
Okay, ma'am.
Madam.
Please participate.
request all the participants to mute your mic.
Ma'am, Radha ma'am, can you hear me, ma'am?
கேக்குது சார்.
Yeah, yes, sir. Yes, sir.
Ma'am, put on a co-host, ma'am.
Sir?
Ma'am, you can add co-host.
சார் இல்ல சார் மேமால பண்ண முடியாது சார்.
சார்
யாருக்கு பண்ணணும்னு நீங்க சொல்லுங்க, நான் பண்றேன் சார்.
சார் சிவசரவணனுக்கும் பாலாஜிக்கும் பண்ணுங்க சார்.
ஒன் செகண்ட் சார். பாலாஜி ஆர்ன்றது கோஹோஸ்ட் பண்ணணும், நீங்க வந்து ஹோஸ்ட்ல சார்.
ஆமா சார்.
இப்போ உங்களுக்கு நான் ஹோஸ்ட் மாத்திட்டு நான் மீட்டிங் லீவ் ஆயிடுறேன் சார்.
ஓகே சார்.
தேங்க்யூ சார்.
தேங்க்யூ
மேம் சொல்லுங்க மேம்.
ஹேமசுந்தரி மேம், ஆடிபிள்?
கேக்குது சார். நான் பேசுறது கேக்குதா சார்?
Okay ma'am, can you go to the live ma'am?
Yes sir.
One second ma'am, I share my screen ma'am. Ma'am, screen is visible?
Yes sir, now only it's starting. Yes sir. very good afternoon to one and all present here. Myself, H. Hemasundari, on behalf of Dr. MGR Educational and Research Institute, welcome you all for the second session of Day 8 panel discussion COVID-19 stress management and mental health of the event MGR COVID-19 COVID event. Now, I would like to invite our Dean Enders, Dr. N.S. Subhashri ma'am, to deliver the keynote address. Ma'am.
Thank you, Dr. Hemasundari. Am I audible?
Yes, ma'am.
A warm good afternoon to all present here. It's my pleasure to extend a cheerful welcome to you. Your presence makes us very happy. Today, we are in day 8 of MGR COVID-19 COVID event, 21 days, 33 departments, and 41 events. This session is going to be a panel discussion on the stress management during COVID. On behalf of the department, I extend a warm welcome to our VC Madam, Provost Sir, Rector Sir, Registrar Sir, Additional Registrar Sir, all joint registrars of all campuses, directors, deans, and other executives, all HODs, all teaching and non-teaching staff, and technical support team. I would like to thank and mention and congratulate and welcome my technical team, my STEM staff members, and all other supporting staff for the successful conduct of this event. Fellow members, please join in me in giving our guests the most cordial welcome. On behalf of the department, let me welcome today's chief guest for the panel discussion, Dr. Nitin Kumar N, Senior Neurologist, Fortis Hospital, Bangalore, and Dr. Kumar PS, Chief Orthopedic Surgeon, Mysore. Welcome, sir. I welcome you for this session, and I thank you for giving concern in attending our program. I think this is going to be very, very useful program for us. The way you have given the ideas for panel discussion were very excellent, and this session, I hope it is going to be an eye-opener for all of us. Small steps in the right direction are better than big steps in the wrong direction. So we are moving in the right direction. So I welcome all of you to join hands with us to eradicate COVID-19. Once again, I welcome all of you and all the participants of today's event. Thank you.
Thank you, ma'am. Now the session will be continued by Dr. Nirmala Krishnan. Nirmala, ma'am.
Am I audible?
Yes, ma'am.
Thank you. So good afternoon to one and all. So on behalf of first year BTech Engineering and Technology of Dr. MGR Educational and Research Institute, myself, Dr. Nirmala Krishnan, feel proud and privileged to be the moderator of today's panel discussion. So I take this opportunity to welcome all the participants and all the executives of Dr. MGR Educational and Research Institute. So here today, we have two medical experts. One, Dr. Kumar, who is a Chief Orthopedic Surgeon, St. Joseph's Medical Hospital, Mysore, and Dr. Nitin Kumar, who is Chief Neurologist, Fortis Hospital, Bangalore. So I welcome the two medical experts for today's panel discussion on COVID analysis and decoding the third wave. So I welcome you, medical experts, doctors, Dr. Kumar and Dr. Nitin Kumar for the panel discussion. So first of all, let me introduce the two doctors, Dr. Kumar and Dr. Nitin Kumar, to the gathering. So first, Dr. Kumar, he's an orthopedic surgeon in St. Joseph's Hospital, Mysore, and he was graduated from University of Mysore and MS in ortho at Mysore Medical College, Rajiv Gandhi University of Health Science. So he has around 19 years of experience in the field of orthopedics, and he works for various hospitals in and around Mysore. And he has also 2 years experience in teaching field at Mandya Institute of Medical Science. And he has attended many national level workshops and also conferences. And he's a member of Karnataka Orthopedic Association, Mysore, and Mysore Orthopedic Association. And also he is the co-owner of Sundew COVID Care Unit, Mysore. So I welcome you, Dr. Kumar. And the next one who is going to discuss with us in the panel is Dr. Nitin Kumar. I would like to introduce Dr. Nitin Kumar to the gathering. So Dr. Nitin Kumar is a senior consultant neurology in Fortis Hospital, Bangalore. Dr. Nitin is graduated from Mysore Medical College, and he has done his MD General Medicine from KIMS, Hubli, Rajiv Gandhi University, and MD Neurology in Bombay Hospital, that is University of Mumbai. And he also has around 19 years experience in the field of neurology. And Dr. Nitin Kumar's areas of interest includes stress, epilepsy, movement disorders, migraine, and many other. So we cordially welcome you, Dr. Nitin Kumar, to the panel. So it gives me proud moment to introduce the expert doctors, Dr. Kumar and Dr. Nitin Kumar, to the panel discussion on COVID analysis and decoding the third wave. And it's a pathetic situation that all of us have lost many of our relatives and also friends in this COVID pandemic situation. And so it is very, very important for such programs to know and to get to know the awareness of this COVID-19 and how to come out of that in future. So doctors are going to concentrate on future aspects of awareness, and I welcome you both doctors. And in the panel, I would like to introduce few other young and energetic students. So let me welcome those students also. So Tarun, Deepak, Shrutika, Adlan, and Febi also will join with us in this panel discussion. So now I would like the young students also to participate in the panel discussion and let them introduce themselves to the gathering. So I welcome Dr. Kumar, Dr. Nitin Kumar, and also all the 5 young students to the gathering. So first and foremost, I would request Dr. Kumar and Dr. Nitin Kumar to discuss on today's topic, a brief discussion about today's topic. Sir, please, Dr. Kumar and Dr. Nitin Kumar, join us. Welcome, Dr. Kumar. Welcome,
Hi.
Dr. Nitin Kumar.
Hi. Good afternoon.
Good afternoon, sir.
So, thank you very much. We are indeed honored to be a part of Dr. MGR esteemed institution, and very happy to see all youngsters, budding future of India, happily joining us to discuss it out. So what we are going to do, as we all know that we are in a situation, and we need to have some plan as to how we can come out of this problem. The plan basically depends on what experience we had all these, maybe almost one and a half year. We have gone through this crisis again and again. So, and we know that in future these things are going to happen. We don't know how many times and what would be the magnitude of problem. But again, we have to gather information from the past. We need to sit back, think, and then we need to have certain blueprint as to how we proceed, so that we don't again lose our very close friends. It could be, a lot of people are lost, a lot of lives have been lost. So this is the idea here. So what we will do, of course, it's a panel discussion. What we will do is we will start with a small presentation, a PPT presentation, just to give an introduction to the topic, just to make you understand, get a vibe about what exactly we're going to take it towards. And then we will have the panel discussion part as it was decided. So, Dr. Kumar.
Good afternoon, all. And indeed, it's a privilege to join you on this discussion. Dr. Nitin is a well-known neurologist from Bangalore, from Fortis Hospital. And he has prepared a very beautiful PPT on the above-mentioned topic. Anyways, I also have got some experience in dealing with the COVID patients since we run a COVID center. And this topic is going to be quite interesting. I hope everybody should know the basic things regarding the COVID rather than the much more detailed or higher things. So the main thing is we are going to focus on highlighting the features of COVID and how we are going to tackle the situation, or how we're going to treat the situation, or how we're going to prevent the situation, all in a order. So I think I request Nitin to present the PPT.
Yes, sure.
Over to you, Nitin.
Yeah, thank you, Kumar. Very nice of you, and we will discuss it out. Yeah, can we have the slides, please?
Yeah, sure.
Is Aparna ma'am?
Yes, sir.
Can you present the screen, please?
Sir, can you please make me the co-host, sir?
Yes, yes. So screen is visible?
Oh, it's not visible to
Not
me.
yet. Yes.
That's right, yeah. Good. I think the slide is visible, but there's a little disturbed. The letters are overlapping on each other. I don't know. I mean, should not be a major problem in this slide, but in the subsequent slides, I think. Yeah. Anyway, as they rectify that, dear friends, as a doctor, as an Indian, what is my experience? See, I'm a neurologist, and Dr. Kumar is an orthopedician. There are doctors who are busily working in the ICUs, the intensivists, the emergency physician. We need to be very thankful to them. We are indebted to them because it's all their hard work, and the nursing staff who have been very, very seriously working, the frontline workers. We have lost a lot of doctors, a lot of nursing staff in this problem. So we, as the other departments, maybe the cardiology, neurology, who are not very actively into the COVID work, but still we see a lot of references. And so what I feel is we can at least reach out or do our bit by at least trying to communicate with the masses. There are so many myths, so many confusions, so many, of course, there's a lot of carelessness and irresponsibilities, which is shown by our own selves. Like our own people don't wear masks correctly, we know that. So keeping these things in mind, we have tried to do certain, the presentation would be basically focused on what went wrong, who should be responsible, what is our contribution for that irresponsibility, what is going to be the future, the third wave, and what are the drawbacks, what are the limitations, what are our strengths, all those things we can discuss it out. Okay, next slide, please. Yeah. So the story so far. See, it was in Jan 2020 that one person was reported to be positive for COVID in India. That was the first case. We were very panicking. The whole of India was in a shock that even in India we have seen this COVID case. And then later on, we know what all happened. The first wave came. Many districts, many cities had their own different waveforms. Delhi almost had 3 to 4 waves. So looking at the amount of trauma, the problem what we have gone through, it's enormous. So nearly 30 million cases have been reported so far in the second wave, and that is almost 3 crores, and almost 3.4 lakh deaths have been noticed all across India. Nearly 600 doctors have lost their lives working to save patients, and almost 2 lakh crores of revenue has been lost during these pandemics. So this is the amount of damage what this thing has created. Next slide, please. Yes. So looking at this, the thing is, whenever there is a problem, it is important that we know ABCD about this problem, the basic, the bird's eye view of any particular problem, the common masses should know correctly. The disease particularly involves the respiratory system. That means the point of entry of the virus is through the nose and through the mouth. Okay. What does it say? It gives us an information that if you are able to save your mouth and nose, preventing the virus getting inside your system, that means you're going to be safe. That also means that how many people have been very serious about taking this into consideration and wearing mask correctly. I will get down to this point in the subsequent slides, like what are the fallacies we have got through and allowed the virus to get into our system. So that was as simple as that. Just not getting in touch with this virus by any means. It could be the social distancing, it could be wearing a good mask, correct mask, or it could be sanitizing everything. We could have avoided. This is not something which was not avoidable. That is the point I'm trying to make. So that's it. Once the virus gets into the system, then it becomes very difficult. Once you allow the enemy into your fortress, then the war is going to be difficult. If you're going to control the enemy at the entrance itself, that makes a lot of difference in the outcome. So wearing mask, sanitizing, social distancing would have been effective if everyone sincerely followed it, like religiously follow it. That's all. We need to be sincere, we need to be honest, we need to be very dedicated, and that makes a lot of difference. So how did the virus made an impact which was so big in a very short time that we all know how things went bad? And there are many reasons why the virus made such a big impact. This particular virus was not something like a regular customer. When we speak in terms of microbiology, this particular virus has a tendency to mutate, keep changing its phase. It will escape. It can fool any kind of methods to curb it. So it's not as easy as what we treat other conditions. Let it be tuberculosis or even HIV. We have a plan. We know what an HIV disease is all about, how it is coming, how it's going to affect an individual, how do we grade HIV, what are the treatment protocols we have got, what are the tests we are going to do. So basically for a particular medical condition, doctors are equipped both by knowledge as well as the supportive investigations to make a proper diagnosis, and we can give a proper clear information, like how many months, how many years the patient is going to survive, what are the likely possibilities that the complications can happen. But when it comes to COVID, we are dumbstruck because every moment new things come out. Have we not seen every day one or the other new changes in the statements with respect to COVID? Let it be WHO or even we doctors have told. There was a time when remdesivir was a drug of choice. It was like Rambana, we say. That is there. I mean, many people, used to run here and there from district to district in search of remdesivir. A few weeks back, we got an information from the WHO saying that remdesivir is not of any use in COVID. So looking at this, what do we understand? See, here is an enemy we have not read about. We have not read the enemy correctly. That means it can fool us anytime, and it is not it's not going to be different even even in the third wave also. It can cheat us, it can confuse us. So these are all the points which makes us to be we need to be smarter this time. So then now coming to the blame game. See, once everything goes well, let us say we are playing a football game and we are winning the match. As far as we are winning the match, everybody are so happy, everybody will appreciate each and everyone, even the smallest member would be appreciated. But if we lose the match, then the blame game will start, and then there'll be so many heads will start rolling. So this blame game is going to be this is one important psychological problem with respect to any condition. And we Indians somehow have our own logistic issues here. So this blame game, how much has it contributed itself to the problem is also an important thing to be discussed about. So let's say, I mean, next slide, please. Yes. So, I mean, some of the slides have not come out the way how it was presented. I think it's fine, sir. It is okay. You can just put it to one side. That's okay. Some of it has got reformatted. Thank you so much. That's absolutely okay. Yes. So reasoning versus responsibility. So what does it mean? A lot of people start giving an explanation about the responsibility, who was responsible and what was the reason why we failed. Okay, so everybody will start telling his fault, her fault, their fault, not me. So most all of the time, I mean, you can just go and interview any person on the roadside and ask what was the reason why we had this problem. He will not say it was my mistake, I did it, I was a part of this problem, and he will never accept it. He will say government was not doing its job. Government failed in controlling the pandemic. If our government has failed in controlling the pandemic, what was American government doing? See, all the governments will fail. This is not something which we can you can catch it by its horns immediately. You have to understand that governments are doing it. Could be Tamil Nadu government, it could be Karnataka, it could be the Indian government. All have done what was possible within their limits. At the same breath, I wouldn't always kind of appreciate even the governments for what they have done. But they could have done it much better than what they have done this far. But again, this gives us a chance to just point fingers towards the government and escape. Second thing is about the health system of the country. The health system of the country was, many people feel that the health system of the country was not geared up. What do you mean by gearing up? See, for example, Dr. Kumar is an orthopedician. He would be in a better position to explain to you. He has a hospital, let's say. Yeah, next slide. Yeah. Let us say in his hospital, he has got 2 operation theaters. And every day he is in a position to do at least 4 or 5 surgeries. Let's think like that. Okay. Now, all of a sudden, right in front of his outpatient department, in front of his hospital, one bus carrying 100 people, suddenly underwent a major accident, and they are bringing in around 60 to 70 people with broken limbs, which needs to be attended to immediately. Will he be in a position to do that? It is not possible. It is not. These are all like humongous, huge amount of problems. Any country or any system cannot always be prepared for a pandemic. Okay, let us see. He will immediately build. He will think that okay, there might be an accident one day here, and he'll build at least 30 OTs in his hospital, and he may operate also. One day he may operate all the 30 OTs. What's going to happen after that? His 28 OTs will be out of work. Okay, so we should not speak. This is what the media people do. They just keep telling things which are just good enough to just speak, but it doesn't have any actual meaning ultimately. So my feeling is these are all some things which are thrown upon the system or government, and then it just gives a way for us to escape out from our own responsibility. And many people do say that doctors could not handle the situation accordingly. See, doctors, if you actually look at the docs, we from the day one when COVID stepped into the country till now, we have always worn the mask religiously, tightly. We have injured our noses and faces, and then we have been using the gowns and PPE kits. We have not had foods on time. It's a problem. It's a huge problem for the all the working people in the medical system. Okay, in spite of stretching ourselves, this is not something which we actually dreamt when we took MBBS. We just took it just to be doctors and do some treatment. That's it. This is something which came all of a sudden, but all of us were geared. All of us have been working. I can hardly there's any attrition. Well, a small percent of attrition could have happened. Few staff nurses would have left, elderly people, but majority have put in their heart and soul, and they've tried to help the country. But again, I understand whatever there are definite fallacies from the government, the health system, maybe the doctors. All these are there, but the larger part is they all have tried their best to handle the situation. So most of the blame is usually on the others. That is what I have observed. This is my opinion. Okay, next slide, please. So this, could you just rectify this slide a little bit, making it a little. We can shorten that. Pull that up a little bit. Yeah, I can just pull it up a little bit. That's sufficient, I think. Just on. It's okay. I think that is okay. I have got my slides in my phone. I think it is okay. I think we can go back. Let's not make people wait. I think that's sufficient. Can we just go back to the yeah. So I was just telling about the reasoning and the responsibilities, and many people feel that there's a lot of problem from the medical side, or it could be the government and other things. What I was just telling that how many of us have ourselves taken things seriously? See, from the day one, the government of India has been whenever you call somebody, obviously that there's a statutory warning saying that COVID is a serious medical problem, and all of us should wear masks, maintain social distance, sanitize your hands, and take care of yourselves, vaccinate yourself. This has been a regular message to everybody whenever you call anybody, right? But how many of us have seriously taken it? How many do we really follow it correctly? Yeah, thank you so much. This should be sufficient, I guess. So there was a study which I had, looked into. This study states that in India, if you just do a general survey about how many people wear a mask when you're in the road, let us say you're just walking in the road, and if you just count all these people in the peak of COVID, let us say in Chennai there was like many 15,000 cases per day, when it was at its peak. You just go in the road, of course, safely in a car or something. You will see around 50 to 70% of the individuals who are not wearing the mask, and around 30 to 40% of the patients were wearing the mask, but they were not wearing it correctly. Ideally, the mask has to be worn on it should come on the ridge of the nose ridge, sorry. It should come here and it should completely cover here. But we hardly see anybody wearing the mask like that. The mask will be either below the nose, or it will be below the mouth, or it will be somewhere in the neck. So when I in the initial slide I told how the nose and mouth becomes an important entry point for the virus. And that if that is overlooked, if that is not taken seriously, if you allow the virus inside, then it is going to start its game. It will start weakening the immunity. It will start involving different systems, multi-system failures, and loss of life. So this is something which is very crucial, but hardly people take it seriously. Political rallies, crowding in market places, craving for alcohol. So when it comes to political parties, of course, the government people will start doing all these things, and there are supporters who are there. So both are equally responsible. The leaders are responsible, and the people who are behind these leaders are also responsible equally. Crowding in marketplaces. I don't know when something is told not to be done. I think that is a time when everybody feels that it has to be done. So when in a routine day, I don't know how much shopping we do, but during COVID time, it becomes kind of it's like as if we miss going to the shops. So often they go to shop, they purchase, they touch everything, come home, whether they wash their hands, nobody knows. So like that, craving for alcohol and smoking. See, why I give these examples is these are the areas where they crowd. If you look at the intensity of COVID, the duration of COVID in the second wave, it took almost 110 days, let's say, almost 3-4 months of COVID effect during this period. The peak was almost 1 to 2 months. Okay, so that means the lockdowns came only for a couple of weeks or maybe for a month period maximum. But in this period, people could not control themselves from having alcohol. So just for this reason, we had seen a lot of queues, a lot of crowding happening there. So these could all have been avoided. I'm just pointing out the possibilities which could have helped. So these things. And there are something called as vaccine myths also. Vaccine myths means when in India, when the government rolled out the vaccines, everybody, I can pull it up a little bit. That's enough. It's visible, I guess, isn't it? Yeah. So poor hygiene and concepts of sanitization I was telling you about. Many people don't understand why should you sanitize, what is the importance, what is the duration, what are the components of the virus which is going to be killed by vaccine by the sanitization. Next is the vaccine and its myths. Initially in Jan, when India came out with vaccines, which was indigenous, Indian-made vaccines were there. Many people started blaming that it is due to some kind of a political agenda, these vaccines have been rolled out, and many did not take the vaccines. And many felt that this vaccine is going to create a problem like maybe impotence, or it could be many complications. They started discussing amongst themselves, and they didn't take the vaccines. And suddenly, see, vaccines, once it is created, vaccines have to be disposed of, because there's something called as cold chain. There is a certain temperature where the vaccines have to be preserved. We can't keep it for long duration in masses, in huge. When you produce vaccines in big quantity, you have to be sure that you don't unnecessarily keep it for longer duration without proper usage. So some vaccines were sent out as a vaccine diplomacy. That's one thing, which was again our question. And again, now there is a shortage of vaccine because everybody are wanting for the vaccine, but it's not easy. The demand as well as the need, these needs to be this particular ratio can be tipped off when a lot of people ask for the vaccine. Okay, but at least India is lucky enough that we've got at least a couple of companies who are producing vaccine. Apart from US, UK, I think the China and Russia, only few countries are in a position at least to produce vaccine. Imagine countries like Burma, Sri Lanka, or so many other countries in the Gulf area. They may just not be even. Next slide.
Sir. Excuse me. I request all the participants to mute your phone, please.
Okay, so this is an important thing. Okay, so a lot of problems happen because people did not know how to wear a mask. Could be. This is called unmasking the mask discipline. What does it mean? See, the government says wear mask. Wear mask doesn't mean you just put it on the face, or you put on cloth on the face, or just there's so many things happened like that, isn't it? When you wear a mask, you're supposed to actually cover it from above the nose. It should be tightly fitting it at the side of the cheek, and then it should come down your chin like this tightly. The straps have to be tightly put behind the ears. See, there should be zero entry from the side. When you put a mask, I have got a mask here. When you put a mask like this, when you do this, what's going to happen is the mask is going to filter the virus. That means that if the virus is coming here, it will be filtered. So that means the virus can be here. It can be around the mouth and the nose area. It could be possibly settled down there. So if that is the case, we have seen so many people touching the mask here. They'll tighten it, they'll put it on top of the nose like this, bring it down. When you keep touching it here, what happens is the virus will come to your hands. And then you remove the mask, then you touch your nose, you touch your mouth, or you touch here, or put your hand in your pocket. Obviously, you're going to transmit the virus from the area which is there on the mask. And you're going to, create, your own problem. Many people don't know that. It's a very common sense thing. Like, when there is something to filter, when you're filtering on water, what dirt is collected there, would you like to put your hand there and mess it? No, you throw it, isn't it? Same here with the mask also. Many don't know. They'll do that. They'll put their hands inside. They'll put it in the pocket. They'll put it in the dining table. They'll put it here, there. So what is the point? You yourself have brought the virus into your system. Okay. So there's something. So when you put a mask, see that you don't touch the central portion. You only touch in the sides. That's all. Only the straps you should touch. You should properly keep it in a place where nobody will touch it. Maybe in a place which is not accessible to children or anybody. So that's very important. Okay, do not touch in the middle portion. It may be containing the virus. Handle it carefully. And how to dispose it. If it is just like a surgical mask like this, we can only one use throw it is. We cannot reuse it. Or if you're using something which is handmade, wash it thoroughly, dry it in sun. So reuse is also sometimes people have to do it. That could be one of the possibilities. We use N95 mask, which is one of the best masks. So we keep it. I keep it in my car over the bonnet area. So good sun rays will fall on that. So 2-3 days it will take for it to get sanitized that way. Okay. So this is important. Next slide, please. Social distancing. See, the WHO says that initially WHO came with a statement that it is something which is a droplet. The virus will be coming out of the nose and mouth when somebody sneezes as a droplet and falls down. And at least 2 meters distance will be something which is going to be a problem. But now, I think a couple of months back, we came to know that this is airborne. So what does it mean? Airborne means it can just float in the air for some more distance. Somebody has sneezed and gone out of that area. If you go there, there is a high possibility that you may get infected. The virus can travel farther distance if it is airborne. That's an important thing. The farther the distance, the better. That means you stay far from anybody, it is going to be safe. All right. So avoid unnecessary outings. That's an important thing. Virus doesn't come to you. This is an important statement. Virus will not come and touch you. You have to go and get the virus to your homes. It's an important statement because it's not going to happen randomly. They'll come into your homes. You go get groceries. You go to shake hands with somebody. You touch some bike and that and this, everything. Come home. You may not wash your hands correctly. You may just, for namesake, you may wash your hands. That's how it comes. All right. Let's move to the next slide. So sanitizing, of course. You can see the picture in the lower part of the slide. That is the typical way how we should wash the hands. This says that all areas of the fingers and palm and the top area is completely washed. At least 20 seconds you have to take minimum to properly wash the hands. Okay, and more number of times you should wash. In fact, when there is a pandemic peak, what just happened a couple of weeks back, we had seen in the middle of May what was the situation. So it's very important. Next slide, please. All right, so this is another important slide. Yeah, this is sufficient, I guess. That's enough. So apart from the mask, social distancing and sanitization, it is important that we do regular exercises to keep our immunity strong. Good balanced diet is important. And of course, there are so many immune boosters. Most of these herbal medications, herbal foods are supposed to be good in containing the, to boost up the immunity. So it's a good thing to go for that. So next slide, please. And of course, the vaccination. It is a very important. Yeah, next slide. Yeah, you can shorten that. That's all. Make it small. I'll put it to one side. Yeah. Third wave. See, this is an important slide. In this slide, I have covered some important key points. See, the third wave, many people still are in denial mode that third wave will not come. The third wave will be not very serious. And so many things like just trying to make some goody statements or trying to feel that just not to panic doesn't mean that you should sit quiet and not panic. It just says that don't panic means your panic sometimes can become a huge problem. So that is why don't panic, think practically. That is what it says. Many of recently, I also had one talk with one of the companies. They strictly told that third wave, let's not discuss because people will get panic. So that means to say that our mindset itself is like, let's not discuss these things. Let us when it comes, we'll see. No, that is not the way. We have to jump into it, see that it's taken, it's discussed out properly, so that we can take care of it. So Professor Vijay Raghavan, who is the principal scientific advisor to the Indian government, he has already said that the third wave is going to be imminent. It's inevitable. It is going to come. It's likely to come in October second half. And children are most likely to be involved in this particular wave, though the adults are not spared. So most of the studies have told that the third wave will not be very serious compared to the second wave. But again, as I say, we don't know the enemy correctly. Okay? And every time it changes its presentation. So we should not be under the opinion that whatever is said by the expert committee is all it's going to happen. It can be beyond that. Let us assume that it may also be serious like the second wave, and let us prepare. That is the best thing we can do at this point in time. Next slide, please. So as you all know, what are the symptoms? The symptoms are usually fever, cough, cold, sore throat, dehydration, body ache, loss of taste, loss of smell. Some people can have, some kids can also have loose motions and vomiting. They can have rashes. They can have poor eating. So these are the few of the symptoms what children can have. It is important to note that children occupy almost 40% of the Indian population. So if it is 40%, it may come to around some 50 to 55 crores of Indian population would be the children. Children meaning now the criteria is until 18 years. So this is the huge volume of population where we have the young adults, like the young children in this category, around 50 to 55 crore of individuals. In that, less than 10 years, we have got around 25 to 26 crore individuals. So that means if the third wave starts hitting our population, almost 50 crore children are vulnerable to this particular problem. Many studies say that around 20 to 30% of these people may have the symptoms. So there are a lot of statistics and data which tells that. But again, we should have our own understanding and take it very practically. Next slide, please. So again, once the kids are at risk, we know that we need to follow all the protocols what I just told about: social distancing, sanitization, mask, vaccination, exercises, diet, and immunity boosters. Okay, next slide, please. Yeah, this only the photo you have to, or it's not required. No, don't. It is fine. I think we can come back. It's an easy slide. Yes. So what are the challenges in the management when it comes to the COVID in children, which is a third wave, what we're discussing about? See, most of the doctors also still have the discussions. Most of the discussions I have heard is all about what is the protocol of treatment. Thank you so much. What is the protocol of treatment? Once a kid has COVID, when should we test, what is the investigations we're going to do, is it X-ray, is it going to be HRCT, would it be remdesivir, is it going to be something else? The discussions are based on only the it's the therapeutic part pertaining to only doctors, but my idea or my viewpoint is different. We look at the challenges. If you remove all these higher order thinking as far as the children with COVID is concerned, let's look at some basic problems. What are the challenges in the management of COVID in children? Do you think the kids will allow us to, to put mask on them correctly? Will they be able to handle the mask? First thing, will they be, if you isolate a kid who has got COVID, is it possible for you to put the child in an isolated room? Will the child be comfortable sitting alone in a room? Will they be able to take care of their toilet functions? Is it possible? In that case, mother has to be with the patient, with the kid. I'm talking about the younger kids. Maybe they're little senior kids, maybe in a position, but let's count the confounding factors. That means the younger kids. So the mother has to be there, isn't it? Or if it is a single parent, I mean, if father is there, he has to be there. Or the elderly, the grandparents may be there. If the children, most of the youngsters are outside working in outside countries. So these are the logistic problems we have to think. Instead of let's look at this. It's not feasible to isolate the kids. Kids always want to stay with the parents, particularly when they have got infection. Parents are the only choice for them. They can't leave the parents. So vaccine, and the third important problem is, till now we don't have any kind of drive with respect to vaccination for the children. Of course, there are few trials going on with vaccination for the kids, but still, whatever information I have got, the vaccination for children seems to be not a very positive picture till now. So every wave of pandemic can be more challenging and devastating than the preceding wave. So when you look at the previous wave, that is first, if you look at the first wave, the second wave was more problematic. If you look at the second wave, the third wave may be problematic. The statistics, the data says that the third wave may be not very complicated compared to children, compared to the second wave, but still we need to look at a pinch of salt. Next slide, please. Yes, challenges with pediatric healthcare structure. I think remove those images, sir. That is sufficient. You can remove the images. Delete it off. Delete it off. Delete it off. Yes, delete it off. Let's not waste time. Delete it off. This also you can delete. Okay. Yeah, I think it's fine. We can study. We can read this. Not a problem. See, challenges with pediatric healthcare structure. The first point is ratio of pediatric hospitals and ICUs are very poor all over the world, particularly in India. Well, what does it mean? You take Chennai. How many hospitals are there in Chennai? If you just group all these hospitals and make a list of all these hospitals, let us say there are 100 hospitals, just for namesake. In 100 hospitals, 98 hospitals will be focused only on the adult care. Hypertension, diabetes, heart attacks, cancer, gastritis, gastric surgeries, urology problems, gynecology problems, only these will occupy around 98% of the hospitals in Chennai. For an example, only 2% of the hospitals will be focused on pediatric, children hospital, child care hospital, and they are all small setups, and hardly they may have few ICUs in that. Okay. Now we may say that Chennai has got 100 big multi-speciality hospitals like Fortis, Malar and all. But again, you go and look into the wards. Okay. Only less than 5% of the wards are dedicated to the children. If you go and see into the ICUs, less than 5% of the beds are dedicated to the children. So when there is a pandemic, what will we do? Suddenly there is thousands of kids are getting infected. Let's say in Chennai, one day there are 5,000 children having COVID. In that 50 or 60 or 100 are very serious. They want, where are you going to get the ventilators? Are we equipped? So this is the logic. We have to question the government, or we have to guide the government. Questioning is different. We have to come out with the answers too. We have to have certain guidelines, certain kind of planning. Okay. So the next important point, like most pediatric, and then the second point is most of the pediatricians are not, they have small clinics, or they'll have They do only those small immunizations, and they take care of respiratory infections, loose motions. They work as an individual, like sectors. It is not like the in adult cases. You see a lot of doctors working in big medical centers, different categories. And see, we all most of us don't have personal clinics, but when it comes to pediatricians, majority work in the personal clinics, so it becomes difficult for them to suddenly charge up and get into the pandemic mode, isn't it? So that's also important. Again, the pediatric nurses, how many nurses are trained to put on IV line for children? We need to train, we need to sensitize them as early as possible. If I'm telling third wave is in October, that means by now we should start working on it. I think on priority basis, we should vaccinate the pediatricians, all the pediatricians and all the nurses who are going to work in the pediatric segment. Okay. And then you may have to give an idea to the government. Maybe the DRDO or any higher scientific committees in India can start manufacturing ventilators, at least to some extent, for the kids. Maybe the IV lines, maybe the nasal prongs, masks, all these are customized for kids. Those things we can suggest right now. And we can start selecting few hospitals and training them to prepare for COVID right now. Not just the pediatric hospitals. I'm telling about all the hospitals, the 98% of the hospitals, majority, half of them be ready, get it up for the pediatric cases in the future. So some things I thought I should inform you. Next slide, please. We'll wind it up shortly. Next slide. I think that slide has that's an important slide about the vaccine. Okay, I'll just tell you that syringe or the injection, what we call that slide. I actually made a point with reference to the vaccination in children. See, India has still not approved any vaccine for children for COVID till date. Covaxin trials are going on recently. So the production of the vaccines are lagging in comparison to the need vaccines. It is said that the Indian government will vaccinate the majority of the population by the end of 2021. According to one of the survey, it is said that to have a good herd immunity, at least this is the last slide. I think we should go to the previous slide. In fact, if the adult population is at least vaccinated, let us say around 70% of the population, adult population, this will come to around 80% of the adult population. So this will come to around 70 crore individuals. This much 70 crore adult population is vaccinated at least before your October. There is a huge amount of herd immunity, and this can prevent the kids from getting the viruses. So that's an important point. At least if you can't vaccinate the children, let us vaccinate the adults on a priority basis. So we need to start at least, yeah, that's the point I was trying to make. And this is the last slide. So controlling a pandemic needs every individual to be very responsible, and they should be helping in preventing the virus spread into the community. I always feel that we cannot depend on any buddy for everything. There are so many things we can do it ourselves, our own contributions. Wearing mask correctly, maintaining social distancing, sanitizing the hands and our objects correctly. It is an important thing what we have to do to the government, to the health structure. Okay, so that makes their life easy so that they can attend to the needy ones in a better way. It's because so many people died in this pandemic because they were not attended to. They could have been, they could have recovered still, just for that reason. So government needs to focus hard on vaccination and to improvise the health structure. I think we should push the government to go on producing more vaccines. What are the logistics? Why only 2 companies are producing? What are the other companies doing? What is the problem? How many days it's going to take for the vaccine to be produced? What are the liabilities? What are the patent related issues? All those things the government and the health advisors have to sort it out as early as possible. So that's one thing. Second thing is to import the vaccines. It could be the Pfizer vaccine, Moderna vaccine, Sputnik. We have to plan and indent it. If there is any kind of funds which are the private organization should join hands. Individuals can contribute money, and we can do something like that so that government can buy those vaccines. So the health workers, and the last point I want to tell is the health workers will need support and goodwill to be energized to work during a pandemic situation, because so often there is this burnout syndrome. In spite of working so hard, there is always, you have already seen, like, so often the health workers are assaulted, they are taken for granted. Now, that is something which that has to be taken care of. Okay, so this is my last slide, and I think I took a lot of time, longer time to complete this slides. And thank you very much for very patiently listening, and thanks for that team who was helping me out through the presentation. I think we'll keep the session open now for the panel discussion.
Thank you so much, Dr. Nitin Kumar. It was a wonderful presentation, and it was very good. And Dr. Kumar, do you have any suggestions?
Well, I think we have covered most of these topics. Am I audible?
Yeah.
Yeah, okay. So at present, the so-called nations where they had a complete control over the COVID, the sudden surge of cases is occurring in the past 2 weeks. Thinking that it is under fully controlled, vaccination is more than 60%, 70% in those nations. In spite of it, there is a new surge of so many cases, including in Gulf, even UK is facing problems, new cases emerging in US as well. So what we mean to say is, so this problem has to be tackled in a very methodical, and also bringing about awareness in the people, and because most of which is in the hands of the common man and the people, not in the hands of government or the doctors or whatever. The healthcare workers, we can provide our 100% of work, but it is not sufficient to cater into 1.3, 1.4 crores of the Indian population. It's really hard and very difficult to reach out to those people and vaccinate or provide the medical facility. At times we have seen there was a lot of scarcity for the oxygen, and so many deaths happening because of just there's no availability of oxygen itself. But that should not be the situation. I think if we go into the panel discussion, we can have a few more questions from our
Sure, sir. Sure.
members.
So now let me invite our young students of today. I'm inviting now Tarun, Deepak, Shrutika, Adeline, and Tejaswini. These 5 young people, let us ask from them. What are all their views? Yes, you can enter. Introduce yourself and you can start the discussion with the 2 experts we are having today in the panel.
Hi, ma'am.
Yes,
Good evening, everyone, and good evening to the doctors. I have a question here for the Nitin sir. Is vaccines necessary, and what are the main pros and cons that you see?
Yeah, that's a very important question. Thanks for your question. Okay, Tarun. See, basically, vaccines, in fact, are the most important, instrument in combating this particular virus. We can see that once the vaccination drive started, what we had seen in our own hospital during the first wave, none of us were vaccinated. So a lot of hospital staffs used to get infected. Every day I used to get the information that at least 3 staffs are positive, 4 staffs are positive. So they used to occupy the beds. So that was happening. So by December 2020, the pandemic came down. So from Jan till February, we started vaccinating all the health workers, all the staffs, the housekeeping, the doctors above 45 years. And, it was like every day there was vaccination going on in our hospital. So what happened by March, again, this March, April, the second wave slowly started trickling. And then, we saw the peaking happening in May. During the second wave, in our hospital, surprisingly, hardly any staff got infected with COVID this time. Okay, until the first week of May, I hardly could hear anybody having any COVID in the second wave. All were happily working in the COVID wards. They were all healthy, but during the peak, couple of people got infected. Okay, so that was like possibly these are the only staffs who were not wearing, who were not vaccinated, and who were not wearing the mask all the time. So those were the ones who got infected. So vaccination is definitely going to be, I mean, that is the reason why even I started, even I didn't had my vaccination done in Jan or February, but I saw the reality. It was a reality check for me. I saw that. Then I got myself vaccinated. Okay, so vaccines are definitely going to be a very important advantage or strategy in this kind of problems. And to be, for a little more information about vaccination. See, our body has to be having the antibodies to fight against these viruses or the bacteria. So for us to have those antibodies, we have to have a small dose of this particular virus particle in the body. It could be either we are going to attenuate the virus, or make the virus very weak and then take it, or we can have one protein from the virus, which is the key protein causing this particular infection. You can take that particular protein, you produce an anti and give it to the patient so that antibodies are formed. So that will save. And we have seen that people who had not been vaccinated had a high chance of getting severe chest infection. They were on the ventilator, many died. People who were vaccinated only once, they had a lesser chance of getting infection. And even if they got infected, they had problems. A couple of them went on the ventilator, but still again, the death rates were very less compared to the ones who had not taken the vaccine. Coming to people who had taken 2 doses of vaccine, they had very less chance of getting infected. That's the first thing. And second thing is, they even though they got infected, there was a very less chance that they went on ventilator, even death. That has happened, but it's very small percentage. You can't take it into a statistical discussion. So that is why vaccination is an important, ammunition in your armory.
There are few vaccination-related side effects like myalgia, getting body pain, slight fever for 24 to 48 hours, dehydration, headache. These are all minor symptoms which cannot be compared with the COVID symptoms or COVID. So definitely everyone should go for vaccination. There should not be any second thought like whether it should go or not. So again, there are choices of vaccination now. There are different companies are providing different types of like Covishield, Covaxin, Sputnik. Sputnik now indigenously, Indian government has started producing Sputnik again. There are only marginal differences among between these vaccines in terms of the efficacy. But whatever vaccines are available, I think everyone should openly go for it.
And there's
one more thing I want to add. There are no long-term side effects which can be told now because there are no studies as such. Because since this is only a short duration, we have started vaccinating only from the March, February. So the long-term effects are not known. As of now, it is safe since all of our health workers in our hospital is been immunized, is vaccinated. So most of them have not suffered from serious COVID symptoms or COVID disease. They are all doing well, except for few, as Nitin said, there are only few people who got fever or the COVID symptoms, and in our place, none of them have gone for ventilator or any other serious situations.
And one more point I would like to add on this, what Dr. Kumar had told. One more major contributor to your knowledge is your media. More than academia, it's the media. What you hear, it could be your WhatsApp, it could be Instagram, it could be Facebook, it could be news channels and anchors and their own opinions. See, we as doctors, we still hesitate to take. See, myself and Dr. Kumar are discussing. We are actually not the frontline workers. We don't work in the ICUs, in the COVID ICUs, or actually it should be the intensivist who should do this job. But still, we hesitate to talk on this topic until we are very sure. We did a lot of research on this topic before we started speaking. But it's so difficult for us to take up a topic which is our own related. The news channels come out with a very bold, dogmatic statements about the COVID, everything. You take everything, even related to vaccine also. They have a tendency to project something from a breaking news viewpoint. So somebody has an allergy or somebody had a problem, even before authenticating or even before clarifying that it is because of the vaccine, they may just come out with a major big breaking news. So this will impact everybody. So my request to everybody is that you have to discuss with the doctors one-to-one. You can take a consultation with the doctor and ask him the question, everything, and then sort it out, rather than wasting your time on hearing these informations and making your own judgments on that. I try to be very upfront here because this is a need of the hour. We can't be very easy going on that. That's my viewpoint. Yeah, please.
Sir, is it also mandatory to take vaccines in the second wave, after the second wave has come and anyone has been affected? Is it possible for them to have the vaccine?
Yeah, I mean, I don't know. Maybe the question is all about the ones who are infected. Is it? Can they have vaccine? See, people who have got infected should also be vaccinated, but it's only that the duration, the latest guideline says that after 84 days, 3 months, they have to get, vaccinated. That's all it is. But even they should also go for vaccination. Once somebody gets COVID, they will produce a certain amount of antibodies to fight against the next infection. So they are kind of vaccinated one way, but again, that doesn't give them any kind of any green signal for them to not to go for vaccines. They have to go for vaccination.
Does one need to take precautionary measures after getting the shot, sir?
Sorry, any precautions after taking
measures
the shot?
After the shot.
See, as Dr. Kumar was telling, majority of the individuals, particularly young individuals, have a lot of reactions. These reactions are basically fever related, fever, body ache, giddiness, and severe pain in certain areas, maybe the shoulders where they've taken the injection, or it could be back pain. So this is something which is known, because that was the amount of antibodies or the proteins which are produced in response to the vaccine. This thing can happen, and this particular issue will not stay for more than 2-3 days generally. Okay, some people can have the effects even after a week or a couple of weeks. Also, they're all after effects. They're basically body aches and exhaustions which can come. But patients are recommended to take Dolo 650 after you take the injection. Okay, don't wait until night, because till night you'll not have any symptom. The day you take the vaccine, you will be super happy because you have been vaccinated. Till night you're happy. In the midnight, you'll start developing severe headache and severe body ache. You will not get proper sleep. You will not know why it's happening until you get up in the morning and realize you took a vaccine yesterday. That was the reason. So, better to take Dolo 650. And if some people are allergic to rashes, we can give them antihistaminics or some allergy preventing drugs. So it's important. These are the usual symptoms. And we have also
in brief, I would like to add, if you get such symptoms, immediately go and attend to your doctor and ask his help. If you are having a symptom which is, more than what is expected, like a mild fever or a mild body ache or a mild pain at the injection site or something like this, which can be managed at home without any problem, which will vanish within, say, about 48 hours to 72 hours. But beyond that, if you have headache, dehydration, or any symptoms coming, that could be aggressive or a more reaction towards the problem, towards the vaccination. If your body, there are so many young people who are very healthy, goes to gym, take a lot of protein, they have very strong, in terms of their immune response. When they are vaccinated, they will react more for the vaccine. And at times, it become intolerable. So in such situation, you should immediately visit doctor and find solution to the problem. And as far as our knowledge goes, if there is only a mild headache, just take paracetamol, maybe 650 or 500 mg paracetamol is enough. Next day or it'll be okay. But we should not take lightly these side effects, because the shortest span of vaccination which is produced is known so far.
See, I request the audience to please mute. Audience, please mute your phone. Thank you.
Yeah.
Yes, can continue the discussion.
The shortest duration, known duration for the vaccination to manufacture vaccine was hardly, it was 2 years. That is for the that was the shortest duration. But what has happened in a COVID situation is all emergency. We all need vaccine. So the companies have started experimenting and producing the vaccine within the shortest period. Okay, it's less than 6 months or 8 months. They come up with the vaccine. So the need of the hour is vaccination, not to protect ourselves from the. We are bound to get some side effects, and there are not much studies regarding the long-term complications of the vaccine or anything. Okay, but as of now, we can take our community into consideration, like doctors' population or the sisters, hospital workers' population, whom were vaccinated at the first instance. So all of them are doing really well. So that is the assurance we can have.
Good evening, all. I'm Deepak from Chennai. Doctor, my question is, preventive measures are overlooked. Can this be a major loophole for complications of second wave?
Kumar, you can take.
Yes.
Yeah.
You can take
I couldn't get the.
Once more, you read, Deepak.
Yeah, ma'am. The preventive measures are overlooked. Can this be a major loophole for complications of the second wave?
No, yeah, definitely. The preventive measures have been overlooked. Like as our Dr. Nitin has elaborated on the facts regarding the vaccination myths and all these usage of masks. Using mask in a proper manner, nobody uses properly. So allowing the virus to get from the top, from the sides, from the below. So all those things, people has to be more educated regarding the more scientific way of using the masks, and that is, I think, it is overlooked. And thinking that the rate of infection, rate of positivity into consideration, which is too much scientific, and that has ended up with as a reason for the second wave. So we can't blame our system for this or anyone for this. I think in overall, my overview, like everyone should take their share of responsibility in contributing to the containment of this COVID.
True.
Yeah. There are a lot of pitfalls, like not all of us are vaccinated. Not all of us are, having a good, decent masks to wear. Like a good cloth is enough to prevent, at least to a major extent, the spread of the disease, to cover up the nose and mouth. So, and maintain social distancing is utmost important in preventing the problem, in preventing the second wave. But we miserably failed. Yeah.
As Kumar was telling, a couple of points just to add. Of course, I always felt that not wearing mask could have been the major drawback. why India had this. I always compare it to a locker in a bank. Okay, see, locker in a bank has to be very safe. Then only your property will be safe. See, the outside, let us say there are some three barriers around the bank. One is a locker, surrounding would be the inner security guards, and entrance will be the other security guards. So the entrance portion, we can take it as social distancing. Okay, if you are able to contain it by following the proper guidelines with respect to social distancing, your first barrier is taken care of. The virus will not enter you. Okay, somehow that has not gone well. You didn't follow any guidelines, just you went out, some friends came, you sat on the bike, went, had some pani puri and came. Now only everybody wants to have pani puri and all those things. That is one problem. So they do that. Once they do come back, that initial barrier is gone. The second barrier will be sanitization of your hands. Now somehow you went out, you came back. Now what do? You wash your hands nicely at least. Properly, you can have some taps. If taps are outside your home, you can wash your hands there with the soap. Hands, legs, you can wash. You can wash your face also. Then you can come inside. Better to take bath if you have been there outside for a long time or it was a very bad crowded area. See, that also was not followed. That the second layer is breached. Okay, so the third layer will be the locker, means the mouth and the nose becomes like one locker area. This is, if it is removed, virus will enter into your locker. That's it. And that once it's gone inside, your lungs will be like your property which is destroyed. So even if these two layers are not taken care of, the third layer is just there with you. It is your own personal thing. Even if this is not taken care of, as Kumar was telling, properly you should wear, tightly you should wear. You should wear it tight enough that it doesn't drop down. If you don't wear it tight enough, I'm not telling tightly so that you break your face. Tight enough, snugly it should fit, so that it is not dropping down. If it is not dropping down, that means you don't have any business to touch the mask to put it up, isn't it? Then you can remove the mask when you come home and drop it in the, maybe in the entrance area somewhere higher up. If you have got some hanger, you can drop it there, or in the car you can leave it, right? So something like that we have to do. We didn't do that. And then again, how to touch it and all he was telling, and how to throw it. Disposing also, how to cut and dispose it. There are people who can may feel that that is, if it is clean, at least somebody may reuse it. I don't know. We have seen that happening with the syringes and stuff like that. These are stories which we have heard about. So these are things. So social distancing and all those things are very essential. Maybe if we could have taken care of this one, we would have avoided at least 50-60% of the problem. That's my projection. Yes.
Good afternoon, mentors and doctors and dear friends. My question is, sir, apart from our, it is related that my question is, in April to April, 15 April, around 15 April, Russian news articles posted that they are saying that it can't be assumed that it is a virus, but rather bacteria that cause death and to lead to the formation of blood clots in the vein and nerves, from which patient dies. Is it, how much it is real, sir?
Yeah.
And one more thing, so adding that bacteria exposed to 5G rays and are the blame. They allegate that it is its cure is antibiotic tablets, anti-inflammatory, and taking anti-glucans, that is aspirin-like, disprin-like things. How much it is real?
Yeah. It's if you go into the pathophysiology of COVID, following the COVID infection, many people, they suffer from thrombotic phenomena, like the vessels, like blood vessels, they get clottings. Okay, people recovering from COVID after 15 days getting admitted or getting discharged, after going back home, staying healthy for say about a week or 10 days later, they will come with small headache or some epilepsy or some weakness in the limbs, or maybe some chest pain, or some suddenly some people will develop if it's a hepatic vein thrombosis, they may develop bilirubin jaundice or something. This is a common pathophysiological phenomenon which is occurring with COVID. Never one should take it very lightly. Okay, it is also a complication which can occur following COVID infection. So that's how so many people have survived later. Mean they will undergo this sort of complications, and we've been treating it very regularly. Like we have seen in mesenteric artery thrombosis, hepatic vein thrombosis, iliac artery thrombosis. That is the vessels coming to the lower limbs getting blocked, and even people have suffered from heart attacks. They die because of the MI, the myocardial infarction. They will have stroke, severe stroke, because a major area of the brain is blocked. The blood flow to that area is blocked because of the thrombotic phenomenon. That's the idea of giving aspirin and other medication, which is normally prescribed following COVID infection. It is true.
Yeah. So I think what Dr. Kumar was telling was apt. A couple of points to add on to that. See, that study, I don't know. I mean, I had gone through that study a long time back, maybe an Italian study or something like that. But again, not many supported it, and few of my colleagues who are in the physicians told that it could be a fake news also. Okay. See, as Dr. Kumar said, it is purely a viral disease, and then virus-related complications. It is going to stimulate the inflammatory system, and then the inflammatory system will start producing its effect, and the effects are respiratory distress, and then complications related to clotting, as he. So, yeah, that's it.
Sir,
Good afternoon, sir.
They are saying that its cure is antibiotic tablets and aspirin.
That is what I'm telling. This particular study itself is questionable. Okay. And you should also be knowing that prior to COVID, before it started stepping in India, we would have seen few videos from showing Chinese people suddenly falling off in the road, suddenly lying dead on the road, like a crow, they'll fall down and die. I mean, ultimately, it sounds like it was a media from the Chinese system just to create that phobia in everybody, so that the economies can be pulled down. There are a lot of things. See, COVID is just one phase, but there are so many people sitting behind the scene to have their own agendas run. So this one study was only one. I think not many studies are supporting that. Okay, if it is a bacterial infection, then we can use an antibacterial. That is an antibiotic, isn't it? Right now, it is a viral problem, so we are all using an antiviral. So this is just to, and so often these confusions always prop up and create more and more problems. So this can hamper the treatment strategies also sometimes. So with the experience and with how patients recover with the antiviral drugs, the proportion of drugs, enormous patients have come out, enormous number of patients have come out well after taking all these measures with respect to antiviral. So I think that is what we have to understand. And I always know that it's something which deviates, it's something not the routine will always grab our attention. So that is also something. So you may be too much carried away with that particular article. But I would like to say that it's a viral problem, which all of us know, the majority of the world knows about, and the protocols are all streamlined. And we see the outcomes also, isn't it? If it would have been a bacterial thing, then why would the vaccines help? We should have created a vaccine for a bacteria, isn't it?
Probably what antibiotics are, what you are talking about is all the complications we are treating. The secondary infection following the lung infection, they will develop secondary infection, all those things, which are the complications of the disease. Like primarily antiviral drugs are given in COVID not to contain it. How much it is effective? It is only effective in the initial 4 to 5 days, where the person gets infected. Within 3 days, if you are not giving remdesivir or whatever injection is, according to the studies what we have done or our own experience. So what is the use? After 4 days, if you start remdesivir, it's of no use, because already the infection is set in. Now the Pathophysiology is different. It has already damaged the respiratory system. So many mucus plugging happens. In one of the, you see, if you go on like this, see, in one of the studies in one of the African countries, they have conducted, people suffering from severe COVID disease who were admitted into ICUs, ventilators, who were on ventilators. As a last resort, they did a bronchoscopy. They put a scope inside the bronchus into the trachea and saw what is happening. They saw thick mucus plugs blocking the airway. They tried to remove it. Not one patient to do, it took almost 4-5 hours for them. So after doing so much of mucus evacuation, lavage and other things, ultimately patient did survive. We came out of that complication. Within 1 day or 2 days, we came out of the ventilator, and following as a routine, after 3-4 days, he completely recovered. Within 1 week, he got discharged. So, but that is not the same. So that doesn't mean that it is like when you say using antibiotic means I have to do a bronchoscopy for every patient. It is not needed. It is purely at the discrimination of the doctor who is treating the patient, not to give whether this patient needs antibiotic or not, whether antiviral drug is needed or not. It is purely in the hands of the doctor who is treating the patient. So I think that was a false statement given. Sometimes, in the hurry, while doing some autopsy or something, they would have found that there were a lot of clots inside the heart, inside the brain, or somewhere. So that means this is not a viral disease. This is a clotting disorder. Anybody can project like that. But it is not. We should all accept that COVID is due to SARS-CoV-2 infection. Okay, COVID-19 is due to infection. We need to get vaccinated. That's our prime focus. How we get prevented from this, from acquiring this infection. How we go about. So I think we need to focus more on that. Yeah.
So let me come up with a small question.
Excuse me, sir.
As we all discussed, past is past. Forget about that. Past is what has happened is happened. Now, coming to the third wave, that is on behalf of all the parents. So our doctor was saying in his presentation that the third wave most likely to hit in another 3 months or so. So within October. So let me ask you, what precaution should we take as all of us are having kids? So how to protect them? Only the government, whatever government does, let them do. So on behalf of the parents, so what should parents do? Or what precautions they should take for the kids so that at least for some extent we can protect them? So as of now, vaccination are also not there for the kids. So only 18 plus they are giving vaccination. So below 18 plus they are not giving vaccination also. So how to protect the kids? So that's
yeah. Thanks for that question. That was something which was the crux of the situation as of now. How to prevent COVID in children? Basically, we should understand what are the challenges we're going to face when it comes to COVID in children compared to adults. See, for adults, at least we can tell them to wear mask. We can tell them to isolate themselves. They themselves will be in a position to handle patients. They can go to hospitals, they can get admitted. It's all possible. But when you look at children, it is a completely different scenario. No child would be comfortable to stay away from their mothers or even fathers when they are sick. They want them to be next to, isn't it? So, and then they can't go alone to the washrooms. They can't handle themselves. They can't eat by themselves. They don't know how to put a mask. They may vomit on the mask. They may just cough out on the mask. So it's going to be a logistic problem. And as you said, how to get through this problem, it is definitely going to be challenging. That is for sure. It is not an easy guideline or easy few steps, easy ways to handle it. It's not going to happen that way. From now itself, we have to understand what is the family dynamics. If there are elderly people in the family, see that the elderly people are kept separate. Children, should be in the separate area, because children can be super spreaders. Once they have problems, they'll run around everywhere. So you see that somebody who has got comorbidities or elderly or should be made to realize that if this is going to be a problem, we have to stay different. Many may not have facilities or luxury to have many rooms. So this is something which people have to understand. That's one thing. Second thing is, the parents should get vaccinated on a priority basis. Okay, so vaccination should just whatever it takes from the, we have to push the government to see that they get the vaccines at our disposal as early as possible. See, as per the information what I have got, by end of December, that means by end of 2021, majority of the Indian population, that is around 70 crores of Indians, are going to be vaccinated, 80% of the adult population. But again, the wave is going to come in October, isn't it? So by at least September, we should see that the government helps us to get this thing done. See, again, once we say that the government has to do it, it will not be again like putting it on the government. It's not like throwing it on the government. It's not all government's responsibility. They are there to take care of things, but again, there are things which they cannot handle individually. We may have to, it should be like a hand in glove situation. We have to work with the government. We have to encourage the government to sit and decide how the vaccines can be if the vaccines are either produced in India, or if they can be procured from Russia, or it could be America, whatever there might be a problem with the financial constraints. One possibility. Second thing is, it could be the legal liabilities, the patency or liability. Let us say there are patients who have taken Sputnik or Moderna vaccine, and many have died, many had a complication. So the companies should be made comfortable. So there is something called an understanding or an MOU between the government and the vaccine producer. So that should be little, those restrictions can be removed, make them feel comfortable to come out and give the vaccines. So there are things like that. So financially it could be, or it could be some kind of a legal issues. So those things we have to push. So instead of being silent on this topic, we all, it could be the bureaucrats, it could be the agent, it could be the health sector functionaries like us. We can discuss it. We can mail to the government. We can have a petition run to the government that if financial issues are there, how can we rectify? Where we stand to help you out, or if there is a legal problems like that, how can we help you out? So see that, or if the local bodies which are producing the vaccines, it could be the Bharat Biotech, or it could be Serum Institute of India, which are producing the Covishield as well as the Covaxin. How can we help them? I'm sure that it's not easy to suddenly upscale the production of the vaccines. But if there's any other, company which is like a standby, I've been told that AstraZeneca has a possibility of producing the vaccines. So I mean, we can encourage them. We can make some recommendations to the government to see that it is all done early. That's one thing. As far as as I said, the parents have to be vaccinated on a priority basis. You should start teaching the children from now itself not to touch things randomly, and not to put their fingers in mouth or eat anything without washing hands. You should keep your surroundings clean. I'm sure that during pandemic, the children will not be traveling outside. They're not having schools. They are inside homes. So see that their rooms, you can have rooms particularly for your children on a separate. You keep it separate from others, so that they can we know the geography of that room. We know how the children is going to move. We know where to keep it. You can fumigate the rooms on a frequent basis, maybe once in a keep the floors clean. See that the children don't take groceries which come from outside. We should at least keep it outside for at least 24 hours without touching. So, something like that. strict plan, we can do it right now and keep it that way. And teach children not to crave for chocolates or anything all the time, because whatever is available, try to see that they accept that. This is a problem. We get it, and suddenly it will disappear. They would already eaten it. So these type of things have to be taken care of. And a good diet, of course, very balanced diet. Some immunity boosters can be of help. Okay, some homemade recipes are there, obviously, which are all based on the Ayurvedic concepts. I've been told that if you can give turmeric in milk morning and night, that can prevent some amount of respiratory infections. It can improve the immunity of your respiratory system. That's one thing you can do for children. From now we can start. And you can add turmeric with ginger, amla powders and all, mix it up in honey and have all those things you can do. I mean, you can just Google it up in the YouTube, you'll get, or if you have any good friends in Ayurvedic system, try to, get their help. And something like this would be of help. There is nothing out of the box you can do, but you have to sit, think, where are the loopholes, try to, check, have a checklist, how a child will get possibly infected, and see that the checklist is taken care of. Okay.
Thank you so much.
Yeah.
Good afternoon, sir.
Good afternoon,
Sir, we have a question. Sir, we saw different types of coronavirus in different country, like alpha, beta, gamma. And but in my question is, India has three types of virus, like Kappa virus, firstly, and secondly Delta, and thirdly, which is newly come, like Delta plus, sir. So, sir, my question is, what is difference between Delta and Delta plus variant, and also why Delta plus is dangerous in all virus, all types of?
I think you got some points on that.
Yeah, basically, so he was asking about the different strains. Different countries have different strains. See, let's understand the dynamics of the virus itself. If you look at the microbiology and the nature, the temporal profile of these viruses as they start growing and proliferating, they can mutate or change the picture. Okay, so these are basically the viral proteins. There are a lot of named proteins on these viruses. They can change these particular proteins so that your antivirals or the way how you are trying to treat becomes challenging. It's basically like that. So as we were telling, different countries have different strains. It's basically because of mutations as per the local flavor. So in India, basically we've got the Delta variants, okay, B1617123, and the Delta variant is supposed to be a very virulent strain compared to the existing other variants. It could be the Alpha variant or the Kappa variant. The present Delta variant is supposed to be very, very complicated, and that is the reason why the United States, the Gulf countries are worried about the transmission of Indian viruses. The one thing we have to remember is that Delta virus itself is 50 times more transmissible than the basic variant. That means that is the reason this time we had seen so many people getting infected, so many known people, friends, colleagues, relatives, so many people died because the new variant will increase the transmissibility. That is one thing. Second thing is it can be very pervasive. It can just go to the depth of the system and start making the complications. So when you speak about Delta plus variant, it is going to be the next version of Delta, as simple as that. Okay, so it is like newer edition of cars. When you buy a newer edition of car or your favorite bike, you can see the newer version has got has a better adaptability. Let us say if you take cars, you know that how the suspension it's going to be, or the chassis, or the whatever mistakes which were there in the existing edition will be rectified in the present one. So the Delta plus has got even higher transmissibility, and it is even more complicated. It has got more multi-system getting involved. Multiple other systems can get involved. the mortality rates are higher compared to the existing or the previous ones. So
basically, that is the difference between the first wave and the second wave. We saw in the first wave, most of the elder people are affected with so many comorbidities, but the younger people were happily escaping from the problem. But when you get into this second wave, you saw that how the virus has muted, and now the presentation is like younger people are affected. Why? Because of the later presentation of the younger people who can happily, withstand the hypoxia as compared to the older people. The older people, they cannot withstand the hypoxia, whereas the younger people, they can happily, withstand the hypoxia. They go to about 80% of their saturation or something, and then they come at the later stage to the hospital. That's how within 1 or 2 days, it's very, very difficult to manage such people. And that's how the mortality is also very, very high in the second wave. So similarly, taking on from here, from the second wave to the third wave, okay, our primary focus is to avoid third wave. Second, if at all it comes, see, we have generally seen the migration of the disease from the older population and older plus younger population. From younger population, next projection is that the pediatric group will also get involved in this COVID infection. So we should be a bit more careful that all the ages are not spared by COVID. Generally, now the people who are thinking like pediatricians and others, if you ask them, they think like, no, this will never come to children, or children are natively immune for the COVID infection. They may think like that because there is no data, absolutely no data regarding this virus. No? So we should not be complacent and accepting all these things and thinking that, okay, it will not come to kids. It can come to kids. It can come to children below 18 years or 15 years, like that, below 10 years. There have been incidents of deaths occurring in pediatric COVID cases also. So basically, the treatment aspect is almost same, like how we treat the adults. Yeah.
Sir, good morning, good afternoon all. I'm Shrutika. So I have a question, sir. So when the world is going towards fighting coronavirus and finding some solutions like what to do, and many people suffering a lot, and another new kind of fungi came, that is black fungi disease. So there is so much of report and the news articles which has come that is it is mainly caused due to zinc and high usage of steroids. So there is no kind of scientific proof that zinc and steroids boost up our immunity. But in hospitals, when we ask what is the reason for the steroids and zinc, they say that it is just for the reason of boosting up our immunity. But in reality, there is no kind of scientific proof existing. So what do you think about this?
Absolutely what you said, there's some point in it to take. Like steroids are given mainly in the therapeutic phase of the COVID disease. Like when we give steroids is to prevent the cytokine storm. That is, when this virus enters our body, enters into the cell, it will start producing this chemical reaction inside the cells, and it will break the cells. There is so many chemical substances released out of the cells. Okay, that few of those were called as cytokines, leukotrienes, and etc. So these are chemical substances are the ones which are responsible for the COVID disease. It will affect the lungs and it will cause a shock lung, or a lung filled with water, and it is like that. Okay, a solid lung-like state, or it can produce high fever, stroke, or fever-related symptoms and signs. Like these things should never happen. That's how in the second wave it is found that the younger people who are very healthy, taking a lot of protein, they react very strongly against the virus, okay, against the vaccination at times. That's why I urge them to go and consult a doctor before taking self-medication at all. If the self-medication is really bad in such situations. That's why following vaccination also, if they are reacting too much for the vaccination, they should consult the doctor. And this is the same situation what is happening with the COVID. Okay, so steroids are given to suppress those. It will never increase the immunity. It's a wrong idea. It will never increase the immunity. Zinc will help in improving immunity. Okay, that's the role of steroids there. And also we give that will help in preventing fibrosis and long-term complications of the lung. That's the reason while discharge also they put you on steroids in those patients. We have recovered. But it is
Sir, and I
not
have another question too.
Sir, I have one
So
question.
one thing is that
Just
Mukarna
Shrutika, you complete it. Shrutika.
yes, ma'am. So another question is comparing to the first wave and the second wave, the number of people who are interested in getting vaccinated is very high. So one of the major reasons for emergence of the second wave is due to the COVID getting resistant to the vaccine which was earlier. So now, what is my question is, now numerous people, although the vaccine is not 100%, numerous people have been vaccinated throughout the country. Now, for example, the COVID is getting resistant to this vaccine. Is there are proper measures which we can take, and is there a proper infrastructure to manage a situation? Because if the situation arises, there will be a lot of losses, and struggles will be so much higher. So what are the measures we can take to avoid all those things?
As Dr. Nitin has mentioned, the vaccination gives nearly 70 to 80% of protection for the disease. So those even after vaccination, there are few people got the infection. Okay, take for example in our hospital, there were only hardly few people, like 5 to 10 members. We are about say 200 people working around. Okay, if all of them are vaccinated, say about 5 to 10% of doctors' population, the hospital staff members got infection, but too in a very mild form. None of them had gone to ventilator. That is the idea, one thing. So vaccination has to be made compulsory, and it should cover the major portion of the population. Then only we get the immunity. Okay. So
Sir, my question is, if a person get affected by coronavirus and his oxygen level comes down up to 70 to 75, then he can be cured by self-quarantine, or he have to
no. That's a very critical condition. What you are saying, 70% is really critical. He cannot be managed at home at all. Left alone, he will die.
Okay, sir. Thank you
when
for
the
my
saturation. Saturation has to be, when the saturation is around 92, 93 itself, patient will be having so much of tiredness. When it goes below 90, immediately they should consult doctor. It cannot be, they should not be waiting at home. Okay. And earlier there was one question regarding this mycosis, like black fungus. Okay. There was a black fungus question, right?
Yes.
What was your question? Can you repeat that?
Yes, one of them asked
Sir,
in the panel.
Yes, sir. I asked about black fungus. So it is that, and another disease and another fungi has come, that is black fungus, which at most affect our sinus and eye part and all. So what they say is, what is the cause of that? The major cause of that black fungus is using of zinc and steroids. So there is no point of that zinc and steroid increases or boost up our immunity. There is no scientific proof that zinc or boost up our immunity. And in many articles they have written that is just for pharma purpose. The pharma sales, they use zinc and other kind of steroids. What do you think about this?
Yeah, coming to that black fungus, the use of steroid, when the body immunity goes down, particularly in diabetic patients, this COVID also in other patients, this COVID can affect the islets of Langerhans of the pancreas. It can cause damage, increase the sugar level. And also, whom they have got the lowest immunity, where the immunity comes down to a certain level, this will flare up, this black fungus. Black fungus is present normally in air everywhere. Every one of us is exposed to black fungus. It is a saprophytic infection. It is an infection which comes when our body has got the minimal resistance power to fight that. Okay, it can get into our body and it can become more and it can produce its own symptoms. Nitin has got a point to add on.
So yeah, I got a question, Shruti, that
Yes,
steroids
sir.
are used to increase the immunity, but the point here is it cannot improve the immunity. You have got your question wrong. It is basically it is used to reduce the inflammatory damage which happens because of the virus. Once the virus infects an individual, it has got different stages of its infection. Initial stage is different. Later on stage is different. Initial stage, we don't need to use steroids because at that time there is no inflammatory storm, like what he was telling, the interleukins and cytokines and all those things are released. Understand? So after a period, maybe after a week period or 10 days period, what happens is the inflammatory changes become the center stage of the problem. Virus may not be active. Virus is contained somehow. They have used some medicines. Viruses come down. We have to understand two things. One is virus and the effect of virus. Okay, virus, once it enters, it will start initiating certain amount of problems. It will start damaging the lung parenchyma, and second stage is it will start, because the virus is there, our body will start, the white cells or the immune system will start fighting against the virus. So it will start producing antibodies, and then it will start producing cytokines, interleukins, many things will be produced. Now the virus would have become mild. The virus would have taken into a backstage. Okay. But what is now becoming a bigger problem is lot of inflammatory changes have happened, lot of secretions, lot of damages to the respiratory bronchioles. So what is going to happen is this itself will kill the patient, or a lot of clotting has happened now. This itself is sufficient enough to kill the patient. Virus is not required now, if you actually understand like that. So until you give steroids, the inflammation will not go down. Okay. See, when this particular virus came in, not many were educated about, the doctors ourselves, we were not educated about this condition well. So for an inflammation standpoint, maybe in the centers where they're not trained, they were using a lot of steroids, because it is not for boosting the immunity, it is rather to reduce the inflammatory change or reduce the immunity overactivity of the immune system. It is used.
Sir, but ultimately it ends up in reducing other kind of macronutrients and micronutrients, which ultimately lead to the entry of black fungus into body. Our body cannot fight against that fungus. So
if you use steroids, what will happen? You will lose the patient even before the black fungus comes in. So assuming or judging things becomes the problem here. We have to understand the things correctly. Steroids are an essential part of treatment, but we should know when to give and how much to give. Sometimes it could be the high doses without the knowledge. Sometimes it could be so offensive because the doctors were completely saturated. Many centers had only junior doctors attending to the patients. Possibly they were giving a bigger dose of steroids. That's a possibility. And first of all, I would ask you one question. This zinc was not the first time we are giving. We have been using zinc for ages. Zinc is an important mineral, trace element required for the body. Okay, we have been using zinc for so many patients with myasthenia who are constantly on steroids. There are so many patients with the renal transplant or they are constantly on steroids, on vitamins which include zinc and everything. Okay, why they didn't get the black fungus? Why only these patients are getting the black fungus? So what I'm telling is the research is still not complete. The points, the hearsay points, what we get is blown out of proportion. We have to understand that point. Zinc and iron, these two elements can be a substrate for the black fungus to grow. It can be a substrate. Why only in the nose it's happening? Why not gut? Why not other areas? That is because this COVID is creating the first night focus for the virus to for the fungus to happily sit on. You're trying to learn things newly. See, nobody is giving zinc to create black fungus. We should not understand like that. We are giving steroids and zinc to create the black fungus, and then patients are dying and the pharma companies are making money. This narrative is what is not correct. Okay. It is steroid that to save the patients, because that is the only instrument at that point in time. Okay, and the other thing is an immunoglobulin, which is lakhs and lakhs of rupees. If you're going to give one vial of steroid, it's going to be 1,000 rupees. But if you give one course of an IV immunoglobulin, which is a little next variant, that will be around 5 lakh rupees. So 1,000 is one side and 5 lakh is on the other side, but both efficacy are similar almost. So that is why the journalists or the media people form their own opinions. They speak to some doctors here and there. There are doctors who have a tendency to speak negative about our own system also. We have seen so often some senior doctors come up and start telling. In Karnataka, there are some doctors like that who will come and say that why doctor are telling you to take rotis when you have got diabetes, because rotis will have gluten, wheat will have gluten, and this gluten will go and damage pancreas, and the diabetes will become more, then they'll get more patients, they can sell more insulin. This is what a doctor has to tell. This is very saddening. They should portray the things as it is correctly, not cook up and tell something. Because see, now you will have the thought like this. You've already got an idea that steroids and zinc will. They thought it is going to increase the immunity, but it is actually causing black fungus. It is not like that. Steroids to reduce inflammation, zinc to increase our strength. But COVID has made us understand now that zinc can become a reason for this fungus to grow also. So we are not going to give it, as simple as that. Okay. All right.
Yes, sir.
Thank you.
Sir, one question, sir. In your opinion, after this pandemic comes to a close, however long that may be, what should be the first step we as a global community take so that we are better pandemics for the next pandemic, sir?
Sorry, I couldn't get that. Can you repeat it again? Sorry.
Okay, sir. Okay, sir.
I think the question was about how should we prepare for the next pandemic.
Yes, that's what he meant, I think.
That's what he meant, I guess, isn't it? Kumar, you want to take it?
He's on mute.
I think he's on mute. Okay, fine. So what I will do, the question is all about how to prepare for the future pandemic, isn't it? So I'll give some points, and Kumar will follow it up with his ideas about it. Okay. See, this is a very interesting part of discussion, and it is an important part of discussion. Okay. What I feel is, according to my own understanding and statistics about our health system, I told you that only 5% of our health infrastructure is going to be dedicated to the pediatrics as of now. Okay. So because not many children will have hypertension, diabetes, heart attack, stroke, brain problems and all to come to get admitted. They'll have only cold, loose motions. They may be having only the immunization needs. They would have fallen down and broken their bones. So some amount of orthopedic, some amount of basic pediatric work is all which is essential for a normal community. So that is why the pediatric, the number of pediatric institutions are less. But the number of pediatricians are not less. You have got a lot of pediatricians. If you go to any roads, you can have at least 1 or 2 pediatricians. It is as busy as that. But still, we have to understand the problem here. All the pediatricians may not have the experience working in a corporate hospital setup or in medical colleges. Not necessary. Majority will be having small individual clinics or nursing homes where they'll be treating the children within a certain limitation bracket. Okay. Now, once you get a pandemic-like situation where thousands of children are coming to the hospitals for admission to get the pediatrician's attention, it becomes difficult. So the pediatricians may sometimes close their clinics if it is a small clinic. So ultimately, they may have to work in the bigger setup. So in a situation like that, how much are their experience in the pediatric ICUs or the high dependency units? What is that possibility? One thing. And second thing is whether the nursing staff or the number of nursing staffs working in the pediatric setup, is it good enough? Is it robust enough? So I'm sure that the pediatricians as well as the pediatric nurses will have a challenge during the subsequent wave. Okay, so what we can do is we can have an induction program, we can have a certain awareness program within the pediatric community. We can give an information to the pediatric society, maybe in all parts of India, such that you have regular workshops about how to handle these cases. You can have some experts speaking on that. We can involve the physicians and the emergency physicians of in the adult system, so that they can pass on the information, the first-hand information to the pediatricians. We can have all the pediatricians vaccinated on priority basis. That's one thing. Second thing is all the pediatrician nursing staff have to be vaccinated on a priority basis, and we should have at least 50% of the nursing population of the cities, districts, and talukas to have at least 1 month program or 15 days program in a pediatric center, so that they know how to put an IV line, how to take care of a kid. All those things they should know. That is one part of it. That is about the manpower, how we can handle. The second part is about the hospitals. How many beds do we have? If you calculate, as I said, only less than 5% of beds are allotted for the children. So what we can do is, my idea is, we have to, at least there might be 2 or 3 big hospitals which are focused only on the pediatrics. So those hospitals will anyway take the pediatric cases. That is not a problem. We have to recognize few hospitals in your locality. Let us say you've got Fortis, you've got Manipal, or you've got some Narayan Hridayalaya branches or something like that, which are there, which are at least 100 bedded or 200 bedded hospitals, which are only taking care of adult cases. We can induct them into the pediatric COVID program, such that at least 60 to 70% of their beds should be made available for the pediatric cases. You have to recognize at least if you have got 10 hospitals, at least 6 to 7 hospitals you have to recognize now itself, and you tell them that this portion, this particular wing, these couple of wings are going to be only for the pediatric cases at that point in time. And the pediatricians are going to be the local pediatricians, the local doctors in that area, the small nursing homes, what I'm telling. You have to assign them to work in those areas. So that is one thing. And the beds can be, the beds can be fine. They can be adult beds, no problem. But the instruments, which are the tubes can be put into the mouth, the face masks, or it could be the injections or the vials and all those things you can customize for the pediatric setup. So we can have an audit. We can think like how many beds will be required, what may be the expenses. We can have an audit on that, and each hospital should be ready. There should be a committee which can have an access to all these hospitals, delegate these particular products, and then see that they're ready at least. So so what is happening is, when there is a COVID emergence, we can first saturate major pediatric hospitals. That is first phase. Second phase, we can open up these hospitals which we have decided that these can work for the pediatric cases. That we can do. And the third phase is, if it is possible, this is my suggestion. If it is possible, what we can do is, each constituency, in your constituency, in your wards, what we can do, we can the local corporators or the politicians there, and see that you can take a big playground, or you can take some open area, and if it is possible to make a makeshift or temporary structure which can accommodate at least 500 kids at a time. You can sit and discuss with your architects, you can discuss with your vendors. You can see, like, how a plan can be created. You may need a vent for that, for the air to properly circulate. You may need one segment which contains only highly infected kids on one side, one segment only for the mild cases, and like that. What would be the cost? What kind of material, which are low costing material, which can be reusable, can we do that? That would be the third phase. These things, the local politicians can take an initiative. You don't have to depend on Tamil Nadu government on that, or you don't have to depend on the Indian government for that. Let them. It may cost a couple of crores of rupees. I think that should be something better in usage compared to the political rallies and creating those problems to the. So these are the things which you have to open up and speak now. Whether if it is feasible, not feasible, it's not. That is all different. But at least open up, start speaking about, can we do something like this? Otherwise, it's not going to happen. Once the COVID comes, when there are no beds, then everybody will start shouting at the government, because most of the parents are having 1 kid or 2 kids, Many kids are not healthy, malnourished. Few parents have got children who have got mentally retarded kids. So it's a very prone category. We need to think about all these things and proceed. So this is the hospital side, what we can do. Doctors, manpower side, what we can do. And I told about the third thing, which is about the vaccination of the kids also. We have to request the government why it is so difficult. Because in America, the Pfizer vaccine is 100% safe for children. That is what the data and their claims all about. I'm sure even our vaccines are going to be 100% safe. That also. So this is my viewpoint about how we can prepare ourselves for the third wave. I mean, Kumar, you can take it from there if vaccination, other thing could be spoken.
Thank you, sir. Now, let me ask you a question. And say we are vaccinated, okay, we have taken 2 doses of vaccines and we think that we are 100% safe and we won't get COVID-19. But how long? This vaccination react in our body for how long? And whether we have to take the vaccination again after 6 months or 1 year, or different variants of viruses are affecting and are yet to come. So the vaccination has to be reinvented or the same vaccine works. So everything is a question mark for everybody. So can you suggest a few things regarding this?
Kumar, you want to go on that?
Yeah, I think it will take some time for the government and the medical system to come out with good polyvalent vaccine. Now, because of the, there are some protocols which is going on in the various other countries, like after 6 months, a booster dose has to be taken. So that will provide immunity further. Okay. But we have seen that people who are vaccinated already with the 2 doses, a few of them getting COVID. That means we are 100% sure that it is not going to give 100% protection, but it can definitely play a biggest role in reducing the need of a ventilator or making the patient too much sick. So in that point, it helps a lot. So until a polyvalent vaccine, which can give a protection on major, virulent variants of the virus, because the RNA virus is always known for its antigenic shift and drift mechanisms, so that every time you find a new virus in a new part of the world, in a different part of the world, so it is basically the nature of the RNA virus. So that's why it is becoming increasingly difficult for the companies to provide a stable vaccine as of now. So I think the time will come. Until then, we should be, when you take the past pandemics into account, what we think now is a small, insignificant health problem. Take, for example, cholera. Cholera, while treating, the mainstay was only to give rice water and hydrate the patient. That's all. There was no vaccine. Now we have come up with a vaccine. Okay, cholera has come down to a greater extent, and now it is insignificant. Likewise, one day will come, maybe all these COVID will come down because of the herd immunity and other things. See, unless every individual in this world is immunized, we cannot expect that the COVID is going to come down that much drastically, because there is always interstate movement of people. See, once you see that the Bombay is less, Bombay is under control. Today, you see already there is some surge of cases in Bombay. Why it seems like that? So it forms the epicenter of COVID in India, almost. Like similarly, where other countries where they are contained so much in the beginning, like countries like Taiwan, Hong Kong, where you hardly saw COVID cases. Now you see when they open up, when people start moving from other countries inside, so naturally there is all possibility that there can be an epidemic. Like in the Gulf country, it is happening now. So around Dubai, now the cases are increasing. in the past 2 weeks. So there is no hard and fast rule that they see all are vaccinated, there is complete protection. Unless we should be aware of protecting ourselves using proper mask and other techniques and strictly follow the social distancing protocol and all. Even after vaccine is the only way to protect ourselves from getting from the infection. We should never take it for granted that only vaccination can protect us or
Thank
can
you
be
so much.
100% protection. I think the take-home
So
message is that.
Thank you so much, doctors, and we are coming to the end of the session. So this is not going to end, so the questions will be overflowing, but due to time constraint, we are closing the session now. So I really thank both expert doctors, Dr. Kumar and Dr. Nitin Kumar, to be here with us today. Even in your busy schedule, I know that doctors are very busy and leaving all the surgeries and leaving everything, you are today here with Dr. MGR University. So we feel really proud, sir. So thank you so much, Dr. Nitin, and thank you so much for your wonderful presentation today. And the discussion was very interesting. And everybody, we are now 100% aware about the COVID-19. And we are sure that we will keep up all those what you have explained us and what you have given precautionary measures. So thank you so much for coming here and joining us in the discussion today. So we feel really proud, sir. Thank you.
Thank you
now
so
coming
much.
to the end of the session, I over to Hema Sundari, ma'am.
Yeah, thank you, ma'am. Now I would like to call Dr. C. Hemalata from the Department of ECE to deliver the oath of thanks. Ma'am?
Yes, ma'am. Good afternoon to all. Is my voice audible?
Yes, ma'am.
Good afternoon to all. I am Dr. Hemalata from Computer Science and Engineering Department. On behalf of first year ENT, Dr. MGR Educational and Research Institute, it's pleasure to give vote of thanks for this massive event, MGR COVID-19, COVID We Win 21 days, 33 departments, 41 events to win COVID on 8th day. I first like to thank our Honorable President, Engineer ACS Arun Kumar sir, then our Vice Chancellor, Registrar, Joint Registrar, all department deans and all department HODs for their continued support and endeavor. And special thanks to Dr. L. Ramesh sir for planning and executing this mega event. It is a gracious moment to extend my gratitude to both the chief guests with unbounded happiness for spending their much valuable time with us. Thanks a lot, sir. It is delighted to thank the entire team with their tireless effort to bring out this event a great success under the guidance of Dr. N.S. Subhasri ma'am, Dean, first year ENT. I extend my final gratitude to all the executives, faculties, and all participants with happiness.
Thank you, ma'am. Thank you all. So I request the participants to fill the feedback form which has been given in the chat box.
Thank you, one and all.
Thank you.
Thank you, ma'am.
Thank you, ma'am.
Participants, please fill the feedback link which is in the chat box. Thank you all.
Sure.